Hi, my name is Raymond Liu, and I'm a DMP student with George Mason University, and I'm here to present my project on reinvigorating healthcare workers and students about SBIRT in an outpatient healthcare setting. Why am I bringing SBIRT to the MAP clinic? Well, more than 27 million adults in the U.S. had a substance use disorder in 2022. Overdose rates in Virginia increased 29% from 2020 to 2021, and in Northern Virginia, drug overdose death rates tripled from 2020 to 2021. What is SBIRT? SBIRT stands for Screening, Brief Intervention, and Referral to Treatment, and reduces substance use disorder. It's proven in evidence-based practice. What are my goals and objectives for this project? My goal number one is to enhance SBIRT education and implementation at the Mount Clinic and foster a culture of proactive substance use intervention and preventative care among healthcare workers, students, and patients. And my goal number two is to establish SBIRT as an integral component of routine patient care at the MAP clinic and ensure the sustainable training of healthcare workers and students in SBIRT techniques and principles. Upper right corner is a QR code so you can scan about more details about my goals and objectives for this project. Now, about SBIRT. SBIRT begins with a screening form at the very beginning of patient intake. I'll be showing a picture of the brief screening form on the next slide. But this is the flow chart for SBIRT. As you can see at the very top, it says brief screening form, and on the bottom it says audit dash craft. Those are additional screening forms if the patient screens positive on the brief screening form. And depending on your score on the audit dash and craft, will risk them as low, moderate, or severe risk of substance use disorder. Now, the audit is specifically used for alcohol use. Dash is used for drug use, and craft is used for alcohol and drug use for adolescents 12 and up. This board is also at the MAP clinic, if anyone ever visits it. On the right side is all the patient education information, and on the left side is the provider education informations. This is an example of the screening forms. As I said, audit is for alcohol use. And depending on the scores on the 10 questions, on a scale of 0 all the way up to 20 plus 24, they can score mild to severe. And on brief screening score, all they have to do on the brief health screening form, all you have to screen is answer yes on just one of the questions. Just the first two, alcohol and drugs. Mood is, we already have a PHQ that's attached to our patient intake. So that's not as important, but just the first two are focused on is the alcohol and drugs. And depending on how they score positive is, we'll go in and we'll investigate a little bit further about their drug or alcohol use with a few questions. See if they're appropriate to use the audit or the dash. So we're going to explain a little bit more about the severe risk. If they score low risk, let's say no past or current use, they have a low level of use and stopped prior to immediate upon pregnancy. So we'll just give a brief advice or written pamphlet. Moderate use, when they had high use in past, including recent treatment, stopped use late in pregnancy. So for any moderate use, we're gonna give a brief intervention, motivational interviewing, and frequent following up visits to the provider. And high risk, we also want to give a brief intervention, and we want to refer and see if they're ready to be referred out to treatment and give them the resources for treatment. So the intervention part, let's pretend they scored moderate to high risk. What do we do? How do we talk to them? First, we want to raise the subject. Thank you for filling form. Question. We want to ask them, oh, I see that you filled the score on this form. Can you have an end question? Explain why did you fill it out this way? Quality of life on your own timeline. What can you tell me about yourself substance use. So as they tell you reasons why they use it, it's they use it for anxiety, or they use it for depression, or they use it to help with insomnia. Next use is when share information in a non-judgmental way, still open-ended questions, but we want to educate them for something, the chart above. We want to tell them that we recommend, for men, we recommend only 14 drinks a week, or 14 drinks per day, and for women, 7 drinks per week, or 3 drinks per day, before you can start having health issues, physical or mental health issues. If it's insomnia, depression, or anxiety, you can increase those mental health issues, or increase health issues such as a cardiovascular risk, cardiovascular disease. Afterwards, we want to enhance the motivation, and want to ask the patient about receipt pros and cons of your use, then summarize where do you want to go from here in terms of your use, what's your goal or vision, and want to gauge the patient's readiness, confidence to reach their goal. If using the readiness ruler. So on the top, you can see a ruler 0 to 10. We always ask this question. We ask, on a scale of 0 to 10, how motivated are you to stop? And with your follow-up answer is always going to be, oh, why isn't it lower? And the reason why is because we're trying to make them think about their own motivations, and we're trying to increase their motivation about why they can't be more motivated to stop their substance use. Afterwards, once they identify the motivations to decrease their substance use, if it's either, oh, my family wants me to stop, there's been negative consequences, I had to call out work the next day, whichever sole reason, we want to develop a plan next. If the patient is ready, it asks, what steps do you think you can take to reach your goal? Affirm the patient's readiness, confidence to meet your goal, and affirm the plan. Can we schedule an appointment to check and see how the plan is going? So at this point, we've built rapport, we've built a relationship with the patient, we've talked to them in a non-judgmental way, and used their own motivations for them to make a change. We're not asking them to become abstinent the next day. We're asking just to reduce the risk, and we can reduce the risk. An example of a goal is maybe we can reduce the number of beers or number of alcohols that you buy at the grocery store, or the number that's available at your house, or maybe we can just reduce it to just 2 drinks in a setting, or maybe just 1 glass of wine in a setting, and we start reducing our amount of drinking use. And I want you guys to watch this video. It's basically summarizing what I just followed up with.
Barbara is a 60-year-old patient visiting a new primary care provider to discuss her antidepressant medication. Barbara completed the audit screening tool as part of the visit.
Thanks for filling it out. We give this form to everyone once a year, regardless of why they come in. It helps us provide better care. Is it okay if I take a look at what you put down?
Sure.
So let's see. It looks that you drink alcohol at least 4 times a week on average, and you usually have 3 to 4 drinks when you do drink.
Usually 3 drinks and glasses of wine.
Okay. That's at least 12 drinks a week.
Something like that.
Okay. Just so you know, my role when we talk about alcohol use is just to share information about risk and to help patients who want help. This is different than telling them what I think they should do. I don't do that.
Okay.
What else can you tell me about your drinking?
Well, I usually drink when I'm at home trying to unwind, and I drink while I'm watching a movie, and sometimes I take a bath, but I also drink when I take a bath sometimes.
Okay. So can I share with you some information on alcohol use?
Okay.
Okay. So there has been a lot of research on alcohol use. And the guidelines we use in this country says that having 7 or more drinks per week can raise the risk of health problems for women.
7?
7.
Wow, I knew my doctor didn't like me drinking the amount that I did, but I didn't know that 7 was the limit.
Yeah, you're surprised to hear that?
Yes. What kind of health problems?
Well, things like heart disease, cancer, liver problems, stomach pains, insomnia. Unfortunately, people who drink at a risky level are more likely to be diagnosed with depression, and alcohol can make depression worse or harder to treat.
Well, that's not good news.
Well, how do you think your drinking relates to the depression you've experienced?
Well, to be honest, I drink sometimes when I'm feeling down, and I find it more interesting and not so blah.
Okay. And how do you feel after you drink?
Well, then I feel blah again.
So there are some answers on this form here. Less than monthly, you drink more than you intend to.
Yes, on occasion.
And sometimes you feel guilty after you drink.
Sometimes I just don't like how much I drink. I sometimes finish a bottle in one night.
So you're not proud of finishing a bottle.
No, it's not like I get crazy or anything, but I just don't like the amount that I'm drinking.
Right. By the way, binge drinking is defined for women as having more than 3 drinks, and there are about 5 drinks in a bottle. So you enjoy drinking wine because it helps make things a little bit more interesting when you're feeling down. But at the same time, you don't like drinking when you have more than you want it to, and then the depression returns after you drink.
Yes, sometimes I feel worse after drinking.
Where do you want to go from here? What do you want to change about your drinking habits?
Well, I don't think that I'm ready to cut down to 7 drinks a week. That seems like a lot. But I would consider cutting back to 2 drinks a night. I think that will be my goal.
If I gave you a scale from 0 to 10, 0 being not ready at all to cut back on drinking, and 10 being very ready, what number would you be at?
I'd say an 8.
Okay. Why do you think it's not something less, like a 6?
Well, I'm more ready than a 6 because I'm ready to cut back on my drinking and I don't want to make my depression any worse.
What would help you cut back to 2 drinks?
Maybe having less wine in the house?
Having less wine in the house will help.
Yes.
What else besides drinking helps you relax and unwind in the evenings?
Well, I like to watch movies, read a book, and take a bath, but sometimes I drink when I take a bath.
So it's not just wine that helps you relax. There's reading a book, watching a movie, and taking a hot bath too.
Yes.
Okay. So it sounds like you have some reasons to cut back on drinking, and you have ways to relax besides drinking, and it sounds like you're pretty ready to cut back.
Yes.
Great. I'd be interested to see how well you do on your goal in the next few weeks. Would you be willing to come back and talk to me about it?
Sure.
Great. So let's see how well you're doing with these new meds.
Okay.
I hope you guys were able to imagine yourself in a healthcare worker's seat, asking those questions and being confident, comfortable and confident, motivationally interviewing our patients here at the MAP clinic. What happens if they screen very severe? Well, there are resources we can provide, and that QR code provides more resources that are in the area. If it's not the Prince William Medical Emergency Room, or Prince William Psychiatric Center, or any substance use or alcohol use help can be provided in these resources, but with the patient education if they're ready for additional help.